digital device, and it works. Well, new at 6, the new research that may have you looking for a different solution.
Well, with all the extra to-dos during the holiday season, keeping track of your blood pressure probably does not make the list.
No, there's a few other things to worry about, but it's actually the most dangerous time of the year for heart attacks and strokes. Our Dr. Frank McGeorge here to explain why and what you can do to reduce your risk, Doc.
Well, you know, Christy and Jason, I see this every year firsthand in the emergency room. People who plan to spend the holiday with their family ended up sidelined with a serious health issue or worse. As hard as it is, it's important not to put your health on the back burner during the holidays.
We definitely see an uptick. In fact, in medicine, we refer to it as the holiday heart syndrome. Around this time, we see lots of ER and hospital admissions due to people overindulging, leading to high blood pressure and exacerbations of chronic problems.
Consuming too much salt is a common trigger, says Dr. Aziz Alkatib, a cardiologist at the Detroit Medical Center.
It causes our bodies to retain water in the blood vessels, and that can raise the blood pressure, leading to spikes and bad health consequences. In extreme cases, an overload of salt can land someone in the emergency room.
Consuming alcohol and extra stress can also raise blood pressure to dangerous levels. Making matters worse, patients are less likely to seek medical help during the holidays.
Unfortunately, all too often we see people who present when it's too late, when the blood pressure and the heart conditions have kind of gotten out of hand. When you have symptoms that are concerning, do not delay in seeking medical attention.
Dr. Al-Khatib's advice?
We all want to enjoy this time of year, but we also want to be healthy and smart about it. Okay, so yes, it's okay to have a dessert, but maybe just limit yourself to one dessert or one drink. Kind of go in with a game plan.
Now, it's also common for people to get out of their routine during the holidays and accidentally skip their doses of medication. To avoid that, you should set an alarm to remind yourself and get a pill case to bring medications along if you're going to be away from home when you normally take them.
I would like to address this one dessert, one drink thing, but let me...
Every doctor's a killer.
Let me instead go back to the salt issue. That has to be tough when other people are often during the holidays making the food that you're not making it.
Well, so that's an important point. You know, if you already have heart disease or heart problems or blood pressure issues, Dr. Al-Khatib says if the food tastes salty, you probably shouldn't be eating it. In general, remember, processed foods like soups and cured meats, they tend to be very high in salt. So if you're going to go to a party, eating some low-salt foods first is a good strategy. But, of course, it truly is something that you need to stick to keep you out of the ER.
Just don't grab at every plate that's out there, which is...
One dessert, one drink, Jason.
Tough.
Right.
Just remember that. Thanks so much.
Yeah. Thanks.
All right, Paul, what are we looking at? We're watching other weather around the country and kind of wondering where we fit into the big picture.
Well, right now, we're